I am Dr. Sri Banerjee, core faculty for the School of Health Sciences and Health Policy. In this video, I will be going over how blood lead levels and continued exposure to lead results in poor overall health. So for starters, when we're thinking about this topic, you want to be thinking not only about what the deleterious effects are and understanding a little bit more how it affects the individual through the life course, but also understanding how to conduct a primary study. So I'm not going to go into much of any detail about how to conduct a study, but what I want you to focus on and be aware of is how this surveillance system runs, how it is conducted. How is it that we can collect information not only within the communities but also within the workplace about lead exposure in the environment? So when we're thinking about childhood lead, the main sources of exposure that you can think of is lead paint chips or other places. But when you're thinking about adult epidemiological lead exposure, these are mainly in the workplace. So can you think of examples of where workplace lead exposure can take place mostly? So we're going to answer this question in a subsequent slide. But let me start off by providing you with one of the premier surveillance systems that are available across the country. And that is conducted by NIOSH, and this is a occupational health national regulatory agency. And so this agency runs the adult blood lead epidemiology and surveillance system. This is known as ABLES. So if you can, if you look into more how this surveillance system works, where the funding comes from, I think a lot of this information is interesting, but beyond the purview of this lecture. But going more into talking about how high rates of lead concentration affects the body, a little bit more about this. So typically 10 micrograms per deciliter, usually that is considered the magic threshold number. It's not actually magic. It's something that is created and something that has been systematically determined from the population levels. But as it turns out, the initial threshold of 10, so anything greater than 10 would be considered harmful. This was actually too high. And so Pennsylvania actually had the third highest prevalence rate among all states, and there's different states that have lead as a focus. So in this presentation, Pennsylvania is the focus. So the average rate so with Pennsylvania, the highest prevalence rate for blood lead levels were greater than or equal to 25 micrograms per deciliter. And then the average rate there, so even though there were high rates as that, was at 5.2. So what the idea is that even at levels as low as 5, there are harmful effects felt even within an adult, even within a full-size adult. A lot of the lead effects are felt, and this is something that is different than what was known in the past, or what was focused in the past. So in a previous slide, I had asked the question, what are some occupational sources of lead contamination? So if you answered or were thinking of painting industry, I had already told you about paint chips, but even as an adult, if you're working in this industry, then you have the potential for exposure. And then construction, battery manufacturing. So according to some of the regulations over the years, the lead has been decreased, but still these are potential sources. And then, of course, individuals that engage in target shooting and guns. So let's sum this up here in this slide about what are the major sources. So what are they? Primarily metal processing. Um, so while that is the primary, when you're thinking about non-road engines and vehicles, fuel combustion, that actually produces a great amount of lead and is a source of exposure. And then waste disposal. So disposing batteries and other types of waste, which may still contain lead. So being aware of that, and then there's other sources. So in a summary, these are the major surveillance systems. ABLES is the major surveillance system, and in adult childhood lead, and in adult lead, you have certain areas to be focusing on, and in childhood lead, you have certain areas to be focusing on. But in adult lead, the main focus is metal processing. So be thinking about the industrial and occupational sources of lead exposure, and then you can focus on understanding how lead influences population health and public health. Thank you for listening.